A unit of the Health and Human Services Department has launched a call for an unusual type of leader. The Substance Abuse and Mental Health Services Administration, SAMHSA, is looking for people who have experienced and overcome substance abuse in themselves or family members. It's called the SAMHSA Trailblazers in Advancing Recovery, or STAR Awards program. Here with details, the director of SAMHSA's Office of Recovery, Paolo del Vecchio. Mr. Del Vecchio, good to have you with us.
Great to be here, Tom.
What are you exactly looking for here, and who are these STARS types of people that you're looking for?
Well, we are looking for individuals who've been champions of recovery, those who have experienced these conditions themselves. And we know, Tom, of course, that mental health and addictions are very common conditions. Up to 1 in 5 of us experience these conditions, myself included. I've been a federal employee for over 29 years, but I'm also an individual who identifies as having lived experience of both mental health and addictions. And we know recovery is possible. We know that the importance of overcoming the stigma, the prejudice and discrimination that still exists with these conditions is really important for us to focus on, particularly these days where mental health and addictions are very problematic, where we see over 100,000 Americans die by overdose last year, where suicide is the second leading cause of death among young people. But the reality is that, we do recover. We're able to overcome these conditions and live full lives in our communities.
And so you're looking for people in the private sector, for example, that have assumed leadership positions and advocated, such as yourself, only on the outside.
That's our primary focus, is looking for those champions at the state and local levels who've made a difference.
State and local government, or could it be someone who is, say, a business leader somewhere?
It could be any, both public and private.
All right. And what's your outreach methodology for people to be able to be aware of this program?
Yeah, we're using a variety of ways to disseminate information. We have a nomination form that's live right now. So if folks go to our website, samhsa.gov, they can find out information about this. Certainly social media and efforts like your own program are key ways of getting the word out.
And I imagine there are support groups and 12-point programs and state and local programs that also address this issue. So might that be a good place to reach out through?
Absolutely. 12-step support groups, family organizations, recovery community organizations across the nation.
And by the way, you mentioned the 100,000 people that died of overdoses in the last year. A lot of this fentanyl is coming in, and this is a big new emerging problem. Have you found that has the danger of crowding out some of the chronic issues like alcohol and substances we're long familiar with?
Yeah, certainly fentanyl is a major concern, and that's a leading factor in terms of why we're seeing continued large numbers of people dying due to overdose. But we can't forget alcohol. I mean, you are right. We look at the data. In fact, when it comes to alcohol misuse in this nation, it's an often overlooked condition. And in terms of its contributions to people dying early mortality, in fact, overshadows opioid overdoses, sadly.
And by the way, do people have an a priori sensitivity to substances and that can lead to abuse, or can abuse lead to the mental condition that continues it? Or maybe is it a little bit of all of the above?
I think it's a little bit all of the above, Tom. And it's, a chicken and egg kind of question. We know that mental health and addictions often go together. Again, my own story is just one example of that. But that is often the case. And
congratulations on 29 years of service. So that's an accomplishment all by itself. We're speaking with Paolo del Vecchio, director of the Office of Recovery at the Substance Abuse and Mental Health Services Administration, part of HHS. And what will happen to those that are identified as these STAR recipients? Do they get a trophy or a speaking tour? What happens?
Yes, we're hosting a gala event in Washington on September 24th at HHS headquarters at the Humphrey Building on the afternoon of September 24th. That event also will be webcast, so folks can tune in and see that.
And what are the deadlines for nominations?
Deadlines for nominations are open now until July the 18th.
All right, so people should get on it pretty soon then.
Yes.
And I just wanted to delve into that issue of recovery a little bit more, because as you exemplify, recovery is possible, but yet in the same sense, someone is always vulnerable. And you hear about, once an alcoholic, you're always an alcoholic, but that doesn't mean you're having alcohol. Is that the case across the board with substance abuse?
It is the case. Again, data that we've collected at SAMHSA across the nation is that, again, vast majority of individuals are able to overcome these conditions. In fact, our data shows that fully 70% of people who've had these conditions identify as being in recovery today. And yeah, we have a saying in recovery that it's one day at a time, and that there's always, concerns about people having recurrence of symptoms and going back and using. And that is the nature of, these are chronic health conditions, similar to diabetes, in that it's important for people to continue to take care of themselves on a daily basis.
Yeah, I guess it's harder than can be perhaps externally observed to kick a habit. And you mentioned diabetes, people trying to reduce sugar. Sugar is like a really powerful substance in that sense. I think the same receptors in the brain work for fentanyl as well as for sugar.
It can be really tough, and it takes courage to start and continue your journey of recovery. For my own self, I do a variety of things. So I exercise every morning. I watch what I eat. I make sure I have good social network of people. I do things like play the guitar and garden. All these kind of things help me with my wellness, and that's what people find really helpful, as well as ongoing treatment. So, I continue to receive therapy myself today.
Sure. And with respect to the STAR Awards, I believe it's also eligible to family members. And that's an important part of this. It may be that the person who has the abuse challenge can be helped by family members, because sometimes they suffer along with the person.
Absolutely. Family is so critical to our recovery. And again, my own journey, family's been essential. So yeah, we're recognizing families. We're recognizing young people in particular here, those that have focused on equity. We're seeing also the growth of a peer support workforce across the country. People like myself who are giving back and working in mental health and addictions. We're recognizing them. We're recognizing advocates. We're recognizing providers who are providing the essential care to help our recovery as well. And
from what you say, it sounds as if hiding it is not a good strategy, but really being out in the open with it. And that way people can help. And That's very true, Tom. Too often these are conditions, because of the stigma, right, that are not out in the light. And what research, in fact, has shown is that when people like myself, when we disclose the condition, that we see us as people beyond the labels that are put on us as addict, as alcoholic, as someone with a mental health problem, but as your neighbor, as your coworker in the federal government. July 18th is the deadline to nominate someone. Paolo del Vecchio is director of the Office of Recovery at the Substance Abuse and Mental Health Services Administration. Thanks so much for joining us. Thank you. And we'll post this interview along with a link to more information about that awards program at federalnewsnetwork.com/Federal Drive. Hear the Federal Drive on demand. Subscribe wherever you get your podcasts.